One of the newer methods on the market is the contraceptive implant, and this has been rapidly gaining popularity recently in the United States. Although it's fairly new to the U.S., there's a lot of worldwide experience. So there's over 5 million of these placed, and actually in the United States we're up to 1 to 2 million. So it's although fairly new, there's a lot of experience with its safety. The implant is a progesterone-only method. It's a small rod, about the size of a matchstick, that goes into the arm about up in here, and it's put in the doctor's office, and that lasts for 3 years. At the end of the 3 years, the rod's removed, and if you still want to use it, a new one can be placed in the same spot. Now that sounds a little intimidating, but it actually doesn't hurt going in. It's like it's no worse than getting any injection. And coming out actually hurts even less. So this is not a painful thing, but it does need to be done in the doctor's office. The amount of hormone is very, very small. So unlike Depo-Provera, which is another long-acting progesterone-only agent, this is a very, very small amount of progesterone, and so you don't have the same side effects that we see with some of the other methods. The biggest side effect of the implant is that it makes your periods irregular and unpredictable. On average, you should have less bleeding, and the bleeding that you have will be lighter than if you weren't on anything whatsoever. It's just that you're not going to know when your period's going to come. If that doesn't bother you, then you probably love this method. However, if that's going to drive you crazy, this would not be the method for you. We also know that on average, the periods and the bleeding tends to get less over time, with sort of a trend, what we say a trend towards amenorrhea, in other words, a trend towards lighter bleeding over the lifetime of the product. But it's still unpredictable, and that's sort of the big catch. This product really doesn't have weight gain associated with it, or acne, or really any other or changes as far as that goes. So I've got an example. This is the device on the Nexplanon. There's really two products. There's the Implanon and the Nexplanon. They're made by the same company. The Nexplanon is just a small improvement on the Implanon. But this is what the device looks like. And just to show you, it's a little intimidating, but there'll be some numbing medicine placed into your arm. And so if this is your arm, basically this is placed by just putting the needle in, and it's pushed into the arm like this. Kind of hard to do with one hand here. And then that's it. So that's the whole thing for putting it in. There's numbing medicine placed so that you don't feel any of that. The numbing medicine stings a little bit going in. And that's the whole deal, how it's inserted. Just to show you, this is what the rod looks like. So this is how big it is. It's a little polymer, like a plastic rod that goes in the arm. For the most part, you can't really see it. You can feel it if you touch it, but it doesn't cause pain or problems that way. So it's a very popular method. It's got the lowest failure rate of any birth control on the market. It's almost unheard of for you to get pregnant with one of the implants in. So if you're looking for a long-term birth control where you don't have to have any hassles of remembering to take something every day or use a patch or a ring, this may be a very good option for you.